Chronic osteomyelitis. Overview. Chronic osteomyelitis is a severe and long-lasting bone infection. It occurs when bacteria enter the bone and bone marrow, causing continuous inflammation and bone destruction. This condition is difficult to cure completely and has a high chance of coming back. Causes. The primary cause is a bacterial infection. The bacteria usually reach the bone through a severe injury like an open fracture, a deep skin wound, or during orthopedic surgery. It can also develop if an acute bone infection is not treated properly. People with poor blood circulation, diabetes, or a weak immune system are at a higher risk. Symptoms. Patients often experience constant dull pain in the affected bone. The area over the bone may become swollen, red, and warm. Other common signs include feeling tired, having a mild fever, and sometimes seeing pus draining through the skin from the infected bone. Diagnosis. Doctors diagnose this condition by listening to the patient and examining the painful area. Blood tests are done to check for signs of infection. Imaging tests such as X-rays, CT scans, or MRI scans are used to see the extent of bone damage. A bone biopsy is often needed to identify the exact bacteria causing the infection. Prognosis. The recovery process requires a significant amount of time. With proper and early treatment, the infection can be managed well. However, if left untreated, it can lead to permanent bone damage, joint stiffness, or the infection spreading through the bloodstream. Western medicine treatment. Modern medical treatment usually involves a long course of strong antibiotics, often given through a vein for several weeks. Surgery is frequently required to remove dead bone tissue and clean out the infection. In severe cases, bone grafting or other reconstructive surgeries might be necessary to restore the bone. Korean medicine treatment. Traditional Korean medicine focuses on removing toxins, reducing inflammation, and strengthening the overall immune system. To fight the infection, acupuncture and cupping therapies are applied to relieve pain and improve local blood circulation. Herbal medicines such as takridokium or hwangryeonhae doktang are often considered must be prescribed with modifications according to individual constitution and symptoms. After diagnosis by a Korean medical doctor. Lifestyle management. Getting enough rest and avoiding heavy physical stress on the affected bone is crucial. Eating a nutritious diet full of protein, calcium, and vitamins helps the immune system and bone healing. Quitting smoking is strongly advised because smoking decreases blood flow and slows down the healing process. Home remedies. The most important home care is keeping any surgical wounds or drainage sites clean and dry. Eating healthy foods and staying hydrated is highly recommended. You should not attempt to treat the open wound with unverified alternative substances. Precautions. It is essential to take all prescribed medications exactly as instructed by the doctor. Even if the symptoms disappear, if you notice any sudden increase in pain, swelling, redness, or a high fever, you must visit the hospital immediately. Always seek prompt medical care for any deep cuts or bone injuries to prevent infection.